So my name is Emily Brown. I am the Patient Education Content and Project Manager for Patient Advocate Foundation. PAF is a 501c3 national nonprofit organization. We offer case management services to patients who have chronic, debilitating, and life-threatening illnesses. Since we were founded in 1996, we have served more than 1.3 million patients, and we've just helped them navigate the healthcare system and offered financial aid to those folks. I have been with PAF for more than 6 years, and 5 of those years I spent as a case manager. So during that time, I was able to help folks choose the best plan for them, and then also able to help them navigate any kind of health insurance challenge that they faced along the way. I do want to thank the American Migraine Foundation for letting us present on this topic. It is such a timely topic and definitely something that has a huge impact on your healthcare over the course of the year. So we'll get into the magic question, which is, what is open enrollment? We've heard the term, we know it's important, but what actually is it? So open enrollment is the period of time each year where you're able to make changes to your health insurance plan. And the changes that you make during open enrollment, actually, they won't go into effect until the next plan year. So right now we are in 2019 open enrollment, which is going to affect the plans for 2020. And the open enrollment period is can be anywhere from 2 weeks to often it's a few months, depending on the type of plan that you have. And just a note, I'm going to be going over some dates, and those are the dates for this year. So that can change from year to year. So it's important to know what you're working with this year, but just know as well that they can change, and just to be just to be aware of the fact that those times might change from year to year. So currently we are in Medicare open enrollment, and that runs from October 15th to December 7th. That's for general Medicare enrollment. We also have a Medicare managed care or Medicare Advantage plan open enrollment period, which runs from January 1st to March 31st. It's great. This year, Medicare has made some big changes in the ease of use for a lot of its online tools. So there's a new plan finder out there that's really streamlined the process and made it way easier to purchase a Medicare plan online. The federal marketplace open enrollment is going to start soon. That is from November 1st to December 15th in most states. So the marketplace is an online hub that's available in each state that allows for the sale of qualified health plans. So the federal government runs a marketplace, and there are also some states that manage and maintain their own marketplaces. So if a state maintains its own, there's a chance that there is an extended open enrollment period. Like in California, I think theirs runs from November 1st to January 15th. And Colorado has an extended open enrollment, as well as Rhode Island. There's several other states that have different open enrollment periods. So be sure, if you live in a state that has its own marketplace, that you're paying attention to what those timelines are. And if you aren't sure whether your state runs its own marketplace or not, you can go to healthcare.gov and type in your zip code, and then at that point you'll be able to see whether or not your state is managed by the federal marketplace or whether it has its own, and then you can access it that way. If you have employer-sponsored coverage, whether through your own employment or through employment through a spouse or family member, it's likely that your open enrollment may be in the fall. A lot of times that's just the grand time to do it, but that could be different. Like here at Patient Advocate Foundation, ours is in March. So, it's important to just be cognizant of that. And if you have questions about when your open enrollment period is, you can contact the HR department for your employer or your spouse's employer, and they'll be able to share that information. So really, the crux of it, whatever the source of your insurance, just be sure to know when your open enrollment periods are, and at that point, it's good to just know that so you're not stuck in a plan that might not work for you. So the only time you are eligible or able to change plans outside of your typical open enrollment period is if you have a major qualifying life event. So for instance, if you get married or you get divorced, if you have a baby or adopt a child, any of those big life changes that you may need to add or remove someone from your plan, anything that's going to affect your coverage or how you use your coverage, it's nice because you are able at that point to look into a special enrollment period and kind of evaluate if the coverage that you have is still what's best for you. Typically, you have 60 days or less to make those changes. So you want to be cognizant of the time. So from the time of your major life event to actually changing a plan, you have 60 days or less. And as well, I want to make a quick note, just voluntarily dropping your coverage or your plan is not going to initiate an open or a special enrollment period. You need to actually have a life event, and instead of just choosing that you don't want the plan you have anymore. So we can get down to brass tacks and kind of some of my suggestions and tips for the open enrollment period and choosing the right plan. And since the open enrollment period is so important, and it's really going to determine what coverage you have for the next 12 months, it's so important to be thorough and to really take your time and make the most educated choice that you can. Just like you would with any other big purchase, you would take your time and look at what your options are, and that's really what we suggest as well for open enrollment. My first tip is going to be pretty self-explanatory, but don't ignore open enrollment. Even if you're happy with the insurance coverage that you have now, you should review your coverage to make sure that there are no big changes or that nothing is really earth-shatteringly different about your plan from year to year. It's also important to participate in open enrollment because some plans don't roll over. So if you have coverage now, just because in the past, even if your plans have rolled over, that doesn't necessarily mean that it's going to do that this year or in future years. So it's important to participate in open enrollment just so you're not either stuck in a plan you don't want or so you're not left with no coverage. So the next most important thing is to look at the overall structure and benefit design of the plan that you're purchasing. So just as I mentioned earlier, if you're making a big purchase, say you're going to buy a car, you're going to look at a lot of the features that the car has. You're going to look at whether or not it fits the needs of your family, whether it fits the needs of your budget. And the same thing should be done when you're purchasing insurance. So does the plan make sense with your budget? Does it make sense for your family and what your family's needs are? So the design and the structure of a health insurance plan really can make a difference in your total cost as well. So it's important to be aware of that. When you're comparing plans, look for a document called the Summary of Benefits and Coverage. So online marketplaces are usually going to provide a link to the Summary of Benefit and Coverage, and as well as the cost. So that's really going to give you a quick breakdown of what the plan looks like from a design perspective. So whether it's an HMO or a PPO, what type of design it is, as well as a quick snapshot of what your expected cost might be. So quickly, before we go any further, I want to kind of break down some of the common terms that you might hear while you're purchasing a plan. The first is deductible. So your deductible is going to be the amount that you owe for health services before your plan begins to pay. So you're going to cover 100% of the costs until you meet your deductible. The next is your out-of-pocket maximum, and that's going to be the most that you will pay during a plan year for covered expenses. The third is a copayment. So you are going to have a fixed amount that you'll have to pay for covered services. So like for instance, you've probably seen this before. You go to your primary care doctor, it's $15 or it's $25. You go to a specialist, it's going to be more. You might pay $40 or $50 for a specialist visit. So those are going to be fixed amounts that you pay for specific types of costs, for covered costs, excuse me. So another one we need to know is coinsurance. So copay and coinsurance kind of go hand in hand. They are similar in that they are both amounts that you pay out of pocket for covered expenses. However, a coinsurance is going to be a percentage of the cost. So instead of a fixed amount, you're going to pay a percentage of what that cost is. So you might have heard of plans being like an 80-20 plan. So in that case, you're going to pay, once you meet your deductible, your plan is going to pay 80% and you will be responsible for paying 20% of those costs. So that's something to be aware of while you're looking for plans. A formulary is a list of approved medications that are covered under your plan. And then a network is also really important, and that's going to be a list of providers that are contracted with your insurance company that you're able to see and also receive the discounted rates that your insurance company has negotiated. So back to why these terms are important to know. Some plans like HMOs, they're not going to offer out-of-network benefits. So if the care that you're wanting to receive is outside of your plan's network, you are going to be responsible for 100% of those costs. So it's important to, really know how that's set up and what type of plan you're purchasing, so you know how it's really going to affect your pocketbook. As well, if you are looking to purchase a PPO that does offer and does approve out-of-network benefits, then most likely you're going to have two deductibles. You're going to have an in-network deductible for covered providers and an out-of-network deductible for those providers who are not in your plan's network. And that can get kind of confusing. And so it's important to know what providers are in network, which ones aren't, and how that's affected. Again, depending on the design of your plan, some plans also have a separate pharmacy deductible, just to make it even more confusing. And in those cases, medications don't count towards the overall medical deductible. So really, it's just so important to be aware of how the plan is designed, because that's going to make a huge difference in what's covered, how it's covered, and what you'll end up owing for it. My third tip is don't buy a plan based on price alone. I know that's easy to say, but if you are purchasing a plan with the lowest monthly premium, often it's not going to be your best option. Plans with very cheap premiums are most likely going to have higher deductibles, higher out-of-pocket maximum, and you may even see more narrow provider networks. So while you're comparing plans, it's important to look at more than what you're going to be paying monthly for premiums, because if you are making your decision just based on what you're going to pay for your premium, lots of times you are going to be paying more in the long run. My fourth tip is to make sure you evaluate your medical needs. So make a list of the recurring medical expenses that you have, like medications, specialist visits, if you schedule like neurotoxin injections, for instance. Most likely the drug coverage is going to be really important for folks with migraine disease. So that's of particular importance. And it's nice because Medicare and the Marketplace both have nice features where you can look at what drugs are covered and how they're covered. So while you're shopping for plans, you're able to look at that information and make a plan accordingly. So another thing to note is it's important to know if a drug is on your formulary for a plan you're considering, but also where in the formulary it falls. So each formulary or drug list is broken up into tiers. So it generally works that the higher the tier, the more you'll pay for a medication. But it's good advice to compare and kind of look at what tiers your prescriptions fall on, so you know how much you might be have to pay out of pocket, and kind of how to maximize those benefits. The next tip is pay attention to covered providers. And again, this one might seem kind of self-explanatory as well. However, we're talking about more than just your normal doctors that you see typically, whether that's your primary care physician or your neurologist or maybe a headache specialist. It's so important to look past those providers. It also means checking on hospitals, labs, pharmacies, urgent care centers, and to see if the preferences that you currently have in your plan now also apply to other plans that are available to purchase. And that's especially true if you have a good relationship with your providers. You want to make sure that you are going to be able to keep those relationships up and keep the providers that you're comfortable with. So pay attention to your covered providers on plans that you're looking at purchasing. The next one is calculate your costs. So in addition to your monthly premium and your annual deductible, you'll want to factor in the out-of-pocket costs like co-pays and co-insurances like we discussed. And that's for doctor visits as well as medications. And you can kind of use your explanation of benefits coverage statements that you get for your medical care and kind of estimate what you used this year in terms of healthcare expenses and kind of use that as a rough estimate for comparing plans for the next plan year. My next tip is if you don't know, ask. If you're unsure about how a health plan is going to cover a service or a medication, call them and ask them. It's well within your right to do that. Every insurer has a contact number that even new enrollees or people who are looking at those plans are able to call and ask questions. And that will really help you evaluate your needs and see if the plan is going to be something that would meet your needs. And don't be shy about this if you have questions, because it's easier to ask during open enrollment than to get stuck in a plan that isn't right for you. One of my last tips is going to be there's no such thing as one size fits all. So what's right for you is not going to be right for someone across the street even who also has migraine disease. So that's again why it's just so important to evaluate what your needs are and make the most out of the time that you have for open enrollment. And only you are going to know what's best for you and what works for you and your family. So the nice thing about open enrollment is that in all of these cases, there is help available when things get overwhelming. For Medicare, you can often go to a local senior center and in your area, and lots of times they have folks who are trained to help and assist in terms of choosing a plan. Also, you can contact your state's health insurance assistance program, and they also have folks there trained to help Medicare beneficiaries choose the best plan for them. So as far as people who have employer-based coverage, your HR department is going to be your best advocate. They're going to be the ones that have the details of the plan, and they'll be able to give you more information. And if you feel like you need a little bit more than just what's available in the plan documents, make an appointment to meet with your HR representatives, and they would be happy, I'm sure, to walk through the details of your plan. And for the health insurance marketplace, you can go to the healthcare.gov website and see if anyone in your network, anyone in your area has the ability to help you one-on-one with the application. They're called certified application counselors, and they might be able to help you with the details in enrolling in a plan if you need help. As well, the Patient Advocate Foundation has a team of case managers who are more than happy to help you roll through your options and figure out what's going to fit best for you and your budget and what your needs are. So you can contact us. We have a special, what we call them care line. So we have a special team of case managers who work with people who have migraine disease. You can contact them at 866-688-3625, or you can go to migraine.pafcareline.org, and you can fill out our portal to get assistance in comparing plans and picking the best plan for you.